Dystrophic calcification. Hello and welcome. In this presentation, we're going to explore dystrophic calcification. What it is, how it develops, where it occurs, and why it matters in medicine. What is dystrophic calcification? Dystrophic calcification is the deposition of calcium salts in damaged or necrotic tissue. It often occurs in areas of previous inflammation, injury, or infection. This process takes place even when the calcium levels in the blood are normal. It is different from metastatic calcification, which results from high blood calcium levels. Pathogenesis of dystrophic calcification. Dystrophic calcification is a localized buildup of calcium in damaged tissues, mainly triggered by cell injury or necrosis. It happens through a few key steps. First, in dying cells, calcium homeostasis gets disrupted. Calcium and phosphate begin to collect inside the mitochondria. These cells also release phosphate-binding proteins, which bind to phosphate and help drive the calcification process. Chronic inflammation and vascular hypoxia can exacerbate the process by causing more tissue damage and promoting the release of inflammatory mediators like tumor necrosis factor, interleukin-6, and interleukin-1, which can influence calcium salt formation. Eventually, calcium and phosphate accumulate and combine to form salts like hydroxyapatite and amorphous calcium phosphate inside the tissue. This buildup can cause even more cell death and tissue damage. Histology of dystrophic calcification. Under the microscope, dystrophic calcification shows some key features. You'll see amorphous, unorganized calcium phosphate crystals. These are the hallmark. They appear granular and stain basophilic, meaning they take on a dark blue or purple color. Unlike other forms of calcification, these calcium deposits aren't embedded in extracellular matrix structures like collagen. Also, the high phosphate-to-protein ratio tells us that there's more phosphate than protein in the calcified areas. Common sites of dystrophic calcification. Dystrophic calcification can happen in many parts of the body. In atherosclerotic plaques, where calcium builds up in hardened arteries. On damaged heart valves, especially those that are scarred. In tuberculosis, where it affects areas of tissue damaged by infection. In soft tissues like muscles, tendons, and even the skin. And one special example is psammoma bodies. These are round, layered calcified structures found in certain types of cancer. Is dystrophic calcification reversible? Generally, dystrophic calcification is not reversible. Once calcium deposits form, they don't usually go away. Treatment may help manage symptoms or slow down the process, but it doesn't remove the existing calcification. Can dystrophic calcification be cancerous? In most cases, dystrophic calcification is not cancerous. It usually happens in dead or damaged tissues and is linked to non-cancerous conditions like inflammation, fat necrosis, or past trauma. But, in rare cases, it can be a sign of certain cancers, such as ductal carcinoma in situ, in the breast. So to sum it up, dystrophic calcification is a process where calcium builds up in damaged tissue, even when blood calcium levels are normal. It's a sign of chronic damage, not necessarily disease by itself, but it can sometimes give us clues about serious underlying conditions. Thank you for listening.